So it's with great pleasure and pride that I present John Kueven.
I like to walk around while I talk. So I'm going to pull the mic off, but Vicki, thank you. It's been 8 months. I started in March, which is actually hard to believe. But I can tell you the leadership at Paulding is absolutely incredible, and a lot of those are here today. And what I get to share with you is mostly not things that I've gotten to do or be a part of. These are great things that the people sitting at this table have done over the last 4, 5, 10 years even to get Paulding to where it is today. And certainly that's behind Vicki. She's an amazing leader. Most of you probably know Vicki. I've learned that everybody in Paulding County knows Vicki. But what you may not know is her passion for her staff and for our patients. And so Vicki, it's been a pleasure working with you for the first 8 months that I've been here, and thank you for your support. I also want to thank the Chamber. Stacy, your team has been incredibly supportive, and we're privileged to be part of the Chamber Chairman's Club, and the county's very fortunate to have you and your team here. So thank you for all that you do. And certainly to Georgia Power, giving me the opportunity to speak to our community. We appreciate everything you do and the support of the Chamber as well. So today, I want to talk a little bit about WellStar Paulding, the hospital, what's going on today, and where we're heading in the future. Going to start with a video we lovingly call our hype video, and you'll see why.
Home is vibrant cities, small town charms, and sprawling fields. Home is baseball games, backyard barbecues, and memories made with friends and family. For over 25 years, we at WellStar have made our home in your community. Whether the streets of Atlanta or your hometown square, WellStar has been there when you needed us the most. And now we want to renew our pledge, a pledge to our home to deliver world-class health care. From new arrivals to old friends, we are committed to serving every patient with care and excellence. We are more than just hospitals. We are a network equipped and connected to serve you effectively day or night. We are more than just workers. We are a team dedicated to pushing the boundaries of ourselves and each other to maximize our impact. 11 hospitals, 3,200 medical staff, 20,000 employees, and nearly 2 million patients served, and we're just getting started. The future is bright. Like our hometown legacy, we too have a dream for our brothers, our sisters, our family. We are committed to pushing the cutting edge in technologies, in treatments, in full recoveries. You're not a statistic, you're our next success story. We want to be there to cheer you on every step of the way. We're more than a healthcare provider. We are your healthcare partner to start life, to save life, for life. So wherever you call home, we are here to serve you, from our family to yours. We are WellStar.
So if you're wondering, there's probably part of you like, I know that voice. That is he does all the promos for the Falcons, and he's the pastor for Georgia Tech. So if you're wondering, you think you've heard that's what, but what a way to get excited, right? We showed those at our town hall, and really gets us excited about what's going on. And a lot of information in that video, but a couple things I want to highlight. WellStar as a system is the largest healthcare system in Georgia, and we're the market share leader here in Atlanta. So we have 11 hospitals, as they talked about. Recently, about 2.5 years ago, we purchased 6 hospitals. And so we basically doubled in size at that point. So we're up to 11 hospitals. We have 5 health parks. Our health parks are a convenient place you can go for all of your outpatient services. So they do everything from outpatient surgery to urgent care, primary care, diagnostic testing, lab work, a variety of things all in one building. They're brand new. They're very beautiful. We have one in Ackworth, actually, that you may have visited or seen. And the goal there is to provide better access for our community and do that in an affordable place without the hospital beds, which can be very expensive. And so one of the goals of WellStar, and I'll talk a little bit about how that affects Paulding, is increasing that access for our community. We also have 9, and actually that is now 10 urgent cares. We recently opened a 10th urgent care. We have 250 medical office locations, We have 19 imaging centers and more than 20,000 team members, 1,200 of which work right here in Paulding County at WellStar Paulding Hospital. So we're a big system. So I want to talk a little bit about what's going on, both locally here in Georgia with healthcare and a little bit nationally, just some things that we are focused on and thinking through as an organization. First, please vote. That's coming up. If you don't know, hopefully you do, the 6th, so on Tuesday. Get out and vote if you haven't done that already. It's very important. It's our civic duty, so that's my plug. Please go vote. But some important things going on. The legislative session starts January 7th. There's 40 days, non-consecutive, coming up. A couple things that we're looking at. We have an eye on a bill that Kaiser is working through and has proposed legislation around where if you have insurance through Kaiser and you're admitted through our ED, in any hospital outside of Kaiser, if you're admitted after we stabilize you, you're required to transfer to a hospital that's inside their network. And if you don't, then you pay out-of-network billing. So you get a nice large surprise bill at the end of that, even if you come in through the ED for a life-saving situation. And so we're keeping an eye on that legislation going through. A big one is certificate of need. So Georgia is a state that's a certificate of need state. If you don't know what that is, it means that you can't just go build healthcare anywhere you want at any time. Healthcare is a bit protected, and in order to build something in the healthcare industry, you have to apply through the state, and you have to show need. Not every state has this. I can tell you I worked in a state that didn't, so in Texas before this, and we had just in our city, we had 19 freestanding ERs, none of which took uninsured Medicare or Medicaid. And so if you went there and had any of those, they could turn you away. All right, they didn't fall under the same federal laws that the hospitals do that take Medicare and Medicaid. So they were only interested in the people that had cash or commercial insurance. And so as we look at the CON here, we're protected from that. And it's important for our not-for-profit hospital because we're able to serve the community based on the entire community. And so it allows us to keep the resources we need to put in and invest in the community here. So we are keeping an eye on CON and as that comes up. Some things going on nationally. Opioid bill was signed by President Trump. We have an opioid epidemic in this country. It's a huge issue. It's a costly issue. That bill being signed was a first step by the president to help curb that. I can tell you at WellStar, we're very focused on it. We have a committee that's looking across the system at what we can do to curb that. And many of you probably know Dr. Tharp. He's at East Paulding. He sits on that committee for us and leads that and is taking a look at how we can reduce opioid use here in Atlanta. The 340B drug discount program. So that's a program for rural kind of critical access and hospitals that have a payer mix that's tough. So if they're serving a lot of uninsured or underinsured, this gives some breaks in pricing on medications. And so that program is getting slashed, which makes it more difficult for some of the hospitals taking care of that population to be able to afford the medication for them. So we're keeping an eye on that as well. And then the other big one on here I want to highlight is some of the cost pressures. Many of you know healthcare is very expensive. We're 18% of the GDP in this country. And as that moves towards 20%, that gets more and more unsustainable as a country. So we've got to work together to figure out how do we reduce healthcare costs, both as a country, as citizens, but also as an industry. How do we work towards that? And I'm going to talk a little bit about that and what we're doing at Paulding here in just a few minutes. So that's what some of the things that we're looking at from a state and national perspective. But what I'm really excited about with all of our community members is talk about our hospital and what's going on locally. This hospital wouldn't exist without you. And I've been blown away by the community support that is provided to WellStar Paulding Hospital. Many of you know and have seen our hospital, I'm sure. It's an absolutely beautiful hospital. We was built brand new in 2014. We moved from our old site in Dallas, and about a 30-bed hospital, and I'll talk a little bit about what the growth here was. But this wouldn't exist without the community, and it wouldn't exist without all of your support and what we do every day. And so this is something we can be proud of here in the community. A lot of time went into this building designing it. And so the team sitting up here, many of them spent countless hours, traveled all over the country to look at best practices. Certainly Vicki was a big part of that and led that team of designing the hospital. And it's a beautiful hospital. It's 112 beds. We have only private rooms. We have it cut off a little bit, I apologize. You'll just have to trust me. I can fudge the numbers. We have 30 adult ER exam rooms, 10 pediatric. You may be surprised to know we see 70,000 ER visits a year in our hospital. 70,000. About 20,000 of those are pediatric. So we serve a large amount of ER patients, and I'll talk a little bit about why that's happening and what we can do to help reduce that number coming in through the ER. We also have 7 surgery suites. We have a cardiac cath lab. The cardiac cath program is fairly new for us. It's about just over a year old. We celebrated our 1-year mark with our what we call a STEMI program about a couple weeks ago. And that program was new to WellStar Paulding, and we looked at how we serve our community. And a STEMI is a very severe heart attack. It's an ST elevated myocardial infarction. I know it sounds scary. It is scary. And you have about 90 minutes that you got to get in there and get the blood flowing back to the heart, or it causes some real severe permanent damage or death after that kind of golden hour, that 90 minutes. And so if you're having to be transported to Kennesaw or Cobb, who do amazing work, but you're losing time in that ambulance. And so we wanted to provide that here locally. And so we started that program a year ago, and the outcomes from that put us in the top 10% in the country for cardiac. So we're excited about that program, and we'll be adding a second cath lab actually in about a year. So we have plans for that going on. When you come to the hospital, you'll notice we have a decentralized nursing model. It's a bit unique. Usually when you go into a hospital, there's a large area where all of our nurses gather on each floor. We don't have that at Paulding. So when you walk in, there's some things you'll notice. It was designed with the staff's flow in mind. So they go and can sit with the patient. They're near the patient. Their work surface and is near the patient. And that does a couple of things. Not only does it help improve our safety, but it creates a healing environment. So even when the hospital is very full, you can walk through and it's very calm. It's very quiet, which creates a healing environment for our patients. We do use an electronic medical record. It's called Epic. So when you come in, we are digital. And then something interesting fact, we are a total geothermal heated and cooled hospital. So as Vicki and the team were designing this hospital, they had 3 things in mind. One was patient safety, which the hospital's been designed for that. One was staff safety and flow. The other was environmental safety. And so this geothermal system, which we have about 230 wells drilled around our site and about 3 miles of pipe that runs into those wells, uses the Earth's natural energy to heat and cool the water going into our system. And so we use about 2/3 less energy than a typical hospital our size. So pretty neat feature there. I believe it's the only one in the southeast that I'm aware of that is geothermally heated and cooled. Oh, too many. So that's led to some recognition. And what's exciting for Paulding County is we have a jewel here with this hospital, and that it's been nationally recognized for these features, for these safety features. U.S. World News recognized the design of that hospital. We get people from all over the world, literally, to come tour it and see what we've done around patient safety and staff flow. And so we're very proud of that. And if you have had the opportunity to come visit us, I've worked in several hospitals. It's by far the prettiest hospital I've ever stepped foot in. It feels more like a 5-star hotel than it does a hospital. That has led to quite a bit of growth. So this is where we were in 2014 when we opened. We saw just over 2,500 patients in our hospital. This year we're going to see almost 8,000 patients in the hospital. So in 4 years we've grown over 64% since opening. In fact, it grew so quickly, they opened in 2014, and we had 2 floors shelled, and they filled up the hospital so quick that in 2016 they came back and built out those 2 floors. And so now we're starting to meet towards capacity again and having to have some discussions about what are next steps for growth at the hospital. So 4 years in, we have filled up the hospital, and pretty exciting stuff. So we know that if we build it and we provide high quality care, the community will come and use the hospital. I mentioned our cardiac cath lab. Again, showing that as we build this and serve the community, we know we can do it in a high quality way that the community responds to. So a year ago, we were doing about 200 cath procedures per year. This year, we're going to do more than 1,300 procedures in our cath lab. So huge growth through our cath lab. That also brings the need for our community to continue to support us. And so, many of you were at our ribbon cutting a few weeks ago for our new outpatient infusion center. Miss Imogene Waldrop very kindly saw a need in our hospital. And one of our patient populations that we serve, we have an oncology program, and a lot of our patients fighting cancer, they get infusions. And these infusions can last literally hours. And our team was providing world-class care in subpar space. It was very cramped, there was no natural lighting, and Miss Imogene saw that and said, we can do better. And so she actually supported us and donated the funds to move our outpatient infusion center and build out a beautiful new space, a lot of natural lighting. We went from 6 bays to 12, so we doubled the capacity and the amount of patients we can care for at one time. And so this is from the ribbon cutting, and I just want to thank her because some of our growth comes from our community, and that's certainly very important to us. As we grow, we keep an eye on quality, and Vicki talked about that. And I think it's important for the community to understand the quality of the healthcare being delivered in this community. So I put up here just some awards that we've received in the last 6 months as an example of what goes on here locally. So Leapfrog A rating, only about 30% of the hospitals in the country are able to achieve a Leapfrog A rating. They take a bunch of publicly reported data and they grade you A, B, C, D, and F, just like in school. And so only about 30% of hospitals are able to achieve an A rating. We were recognized by 2018 Brilliance Vizient Award. It's national recognition for heart failure and sepsis. We actually had several of our nurses go speak at national conferences on best practices around taking care of these patient populations. Health Grades just gave us 100 Best Hospital Award 2018 for general surgery. There's 5,686 hospitals in the country. We're in the top 100 of those for general surgery. 5-star recipient for treatment of heart failure. That puts us in the top 10% in the country for heart failure. 5-star treatment of pneumonia puts us in the top 10% in the country for pneumonia. GI Care Excellence Award puts us in the top 10% in the country for GI care. Top 5% nationally for surgery and GI, 10%, and 5-star treatment of sepsis puts us in the top 10% in the country for treatment of sepsis. These are ones we were recognized for just in the last month. So there's some great work going on. And I'm going to talk a little bit about why that's so important. But what's next for Paulding? So we've got this beautiful building, we've got a great team, great results. Where do we go to from here? I think the first thing is we have to invest in our community. And when I was talking about that 18% of GDP, a huge piece of that can be curbed and that expense from preventative care. So there's obesity in this country. About $335 billion a year is spent on obesity and treatment of obesity-related diseases. So it is our job to help the community fight this, to be part of that. We also know that smoking, diabetes, and cardiovascular disease, particularly in this county, are still a focus. 15% of the country still smokes, causes a lot of downstream, and so we want to prevent that. If we can get people healthy on the front end and prevent them from coming in the hospital, it is much cheaper and they have much better outcomes. And so that's going to be our focus with the community is how do we drive preventative measures and treatment. We also need primary care. So the 70,000 ER visits I talked about is not because 70,000 people needed to go to the ER. It's because that was the only place they had available to go. We have a huge shortage in this county of primary care. And I can prove that. In Georgia, all right, so if we look all over Georgia, the average in Georgia is for every 1,400 people, there's one primary care physician. In order to qualify as a national shortage for primary care, oh, there it goes. It's one for every 3,500 people. All right, so when you qualify as a national shortage, the federal government actually gives you funds to write off medical school debt for physicians that come and serve in that community. So they're saying it's so dire there that we will actually forgive debt in order for these physicians to come here. In Paulding County, we're 1 to 7,300. We're twice as bad as the federally declared shortage. So if you've ever called to try and get a primary care appointment and it's like 8 months off, that's why. All right. But we have to look at adding primary care doctors and urgent care and access points like our health parks so that we can curb that 70,000. Guess where the most expensive place to receive care in a hospital is? The ER, that's right. So if we can keep patients out of the ER, we know they can get great care and their lives are not as disrupted because we can stop things before they start and we can curb that cost. So this is a huge focus for us. We've got to figure out primary care in this county. The other focus for Paulding is all around patient safety. You heard Vicki talk a bit about that. You may be surprised to know that in healthcare, 210 to 440,000 people die every single year in this country from poor care, from errors. These aren't patients that come in that had a massive stroke that we couldn't save. That's not what this is. This is truly errors that occur in hospitals. And in fact, if you line up the top 10 causes of death in the United States, healthcare is third. The only thing better than us is heart disease and cancer. As we look to be a high reliability organization, this is important because being an average hospital doesn't cut it. It's not the right thing to do for our community, and we're not going to be that. In fact, if we were an airline industry, nationally, healthcare, this would be the equivalent of loading up a 747 full of people and crashing it every 7 hours. Raise your hand if you get it on the airline that we're piloting, right? It's a problem. So how do we go about this? How do we address this? So at Paulding, we have made a commitment. And that commitment is that we're going to be the best hospital in the country. I've done town halls. I've talked to every one of our staff. Every one of our leaders know this. We're going to be the best hospital in the country here in Paulding County. We're going to do that, and we're going to measure that. We're going to know we're that because we're going to be in the top 10% of everything that we do. All right, so our staff engagement, our physician engagement, our quality indicators, our patient safety, our patient experience. We're going to be in the top 10% of everything that we do. What I can tell you is what this team has built is the basis to do this, and we are actually knocking on the door of being in the top 10% of everything that we do. We're very close in almost every one of these categories, and in quality and safety, we're already there. And in fact, we're in the top 1 or 2% in the country around quality and safety. So I know that we can get here, and it's what the community deserves, and it's why we are passionate about what we do every single day. So how do we do this? I believe there are 2 great paths that we're on that are going to allow us to do this. One is the Malcolm Baldrige Award. And has anybody heard of the Malcolm Baldrige Award? I'm just curious. I know Rita has. A couple of you? So the Malcolm Baldrige Award is the highest quality award in the country. All right. And it started in 1987 by the 26th U.S. Secretary of Commerce, Mr. Malcolm Baldrige. And what was going on in 87 was manufacturing in Japan was starting to take over the U.S. If everybody's heard of Six Sigma, Lean, that's where that developed. And so what they were doing is they were manufacturing so efficiently and in high quality that they had one part. So Six Sigma means 1 error per million things made. So if they made 1 million parts, only one of those would have any sort of error to it. All right, so Secretary Baldrige knew that if we didn't do something, that the U.S. was going to fall so far behind in the global economy, it would just be devastating. So he created a framework of how to practice good business, how to be a high-quality business. So it started in the manufacturing sector, and it extended to healthcare in 1999. And I'm telling you, it's the highest quality award in the country. It's not just healthcare specific, but I know it's the highest quality award in the country because when you win it, the President of the United States gives you the award. Right? It's considered a presidential award. In healthcare, there have only been about 26 hospitals to achieve this, 26 in the country. And I can tell you, I've worked at 2 of those 26. And I've seen firsthand what this framework can do in order to move us to being the top hospital in the country. And both of those hospitals outperform any other hospital that I've seen and are in the top 10% of everything that they do. So I know that this pathway can work. And we're on that journey, and we've started. The team is actually half our team's in examiner training this week, and the other half of us are going next week, and we're submitting our application here in a few weeks at the state level. You have to win at the state level to apply at the national level. And so we're excited to do that. The second path is magnet designation. If you get too many questions on this, I'm going to get Vicki up here to start answering them. But magnet is a designation that only about 8% of hospitals in the country are able to achieve, and it's a nursing designation. And what it does is it requires you to engage your nurses, to engage your staff in strategic planning and process improvement and shared leadership, and for them to be part of what the hospital does, and for them to be intimately involved with that. It's a great recruitment tool. It's a great retention tool, but it's the right thing to do for our staff and for our patients. And so that overlaps very well with Baldrige. And so we're going to connect those two on our journey to excellence. And you heard Chaplain Rhonda mention something during her invocation, neighbors caring for neighbors. At Paulding Hospital, that's what we believe in. You will see that. That's how we fulfill our vision to provide world-class care. That's our tagline, is we're neighbors caring for neighbors. And when you come in our door, you're our neighbor. And you're there in a difficult time, and we're there to take care of you. In the video, my favorite line, the video from the beginning, I don't know if anybody caught it, but it says, you're not just a statistic, you're our next success story. And that's powerful. And so our vision for WellStar Paulding is to be the best hospital in the country. We're going to continue to grow with our community and do great things. And I want to thank our leadership team for being here. I also have to thank the Leadership Paulding class for coming out and supporting me through this. And I disagree. It is the best class. Sorry.
You're not done yet.